This second micro lecture in the basic listening sequence will further develop our listening skills through responses to our patients and caregivers, the art of encouraging, paraphrasing, and summarizing. Let's start with encouraging. We tend to think of encouraging as something we do to spur patients or their caregivers on during treatment tasks. Encouraging during a counseling moment is slightly different and is focused on letting our patient or caregiver know we understand them and want them to continue talking. Encouragers can be nonverbal. Our silence, paired with head nods, facial expressions, or what are termed minimal encouragers, such as mm-hmm, uh-huh, or Verbal encouragers can be as simple as restating a single key word, such as yesterday, bowling, homework. Often people will follow up with further information about an event. Or a verbal encourager can be as lengthy as a full restatement of what feels like the important part of the message, like you told them you'd be back later, or you asked him to put his laundry in the hamper. We want to restate almost exactly as the patient or caregiver has said. Regardless of the length, a rising inflection can help encourage further elaboration or detail. Moving on to paraphrasing, this involves restating the patient's message in our own words. It's about reflecting back what we've heard to validate and clarify understanding. Paraphrasing is typically used for what a patient might have directly experienced. It's not typically about feelings. That will be covered in another microlecture. Paraphrasing varies slightly from restating, where we're saying intentionally exactly what the patient or caregiver has said. In this case, we are making slight changes while sticking to the true nature of what the patient was communicating. And there's a handy sequence we can keep in mind for paraphrasing. First, choose a sentence stem like sounds like, or I hear that, or so you, or even looks like the situation is, and then choose key words, the main point from what the patient or caregiver was trying to tell you. Provide a brief but clear statement of what you've heard. This can be a bit challenging to stay consistent with exactly what the patient or caregiver has said without exactly restating, but we don't want to add any of our ideas to what was said. And then finally, check in with the patient or caregiver, saying something like, did I get that right? Does that track for you? Did I understand that? Or does that match? Something of that nature. Summarizing, our final bit in this micro skill, is about concisely capturing the main points of the conversation. It helps organize information, reinforce understanding, and facilitate reflection. In mental health therapy, summarizing can be used at the beginning, the middle, or the end of a session. Because our counseling role is embedded in our treatment, we're more likely to have moments of counseling interspersed during the session. So we can choose to summarize those counseling moments immediately, circle back at the end of the session to summarize the essence of those counseling moments, or begin a session by referencing a previous counseling conversation. Summarizing can include both events, thoughts, and feelings, and a check-in can be helpful at the close. This might sound like, today, you shared that you feel less independent after your stroke. This feels bad, and you feel angry and sad about it. Your spouse has been trying to help, but this feels worse. You want to say you can do things for yourself. Today, you shared with me that you decided you want to tell her what you want for breakfast, and you don't want her to ask questions while you do that. Did I get that right? So always we want to be checking in at the end. We can overuse all of these skills, so we want to use them sparingly and when they feel helpful. It can be easy for patients or caregivers to feel like we're just repeating or parroting them, or even making fun of them. If we're using these skills in a helpful way, The patient or caregiver may say, "That's right," or they may actually continue to tell you more. This is what we're hoping for. We want to use our listening and observational skills, and then remain focused and brief for using encouragers, paraphrases, and summarization. Please explore these skills this week in your practice.